Good afternoon, everyone, and welcome to our webinar today titled Peer Support Specialist, a Critical Component for SOAR Programs. I'm Pam Hine, Senior Project Associate with the SOAR TA Center, and I will be your moderator today. Before we begin, just a few housekeeping items to review. A quick disclaimer, the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of CMHS or SAMHSA or the U.S. Department of Health and Human Services. So just a few instructions, webinar instructions. So your lines will be muted throughout the webinar. The recording will be available in about a week on the SOAR website. As you can see, there is live captioning and ASL interpretation for today's webinar. And for downloading the documents, there is a link in the chat box here where you can download the PowerPoint slides and some other handouts, including our presenter bios. You can find them there. You'll also find a link in your reminder emails. So check your reminder emails, and also at the end of the webinar, they'll be attached to the evaluation as well. So there's several ways for you can access and download the documents that we'll be sharing today. We'll have plenty of time for Q&A at the end of the presentations. You'll be entering your questions using that Q&A box at the bottom of your screen. And then we'll have a poll question, so look out for that, and also an evaluation that we kindly ask that you complete for us. So for today's webinar, the learning objectives are, it's really our intention that by the end of this webinar, you will know more about the role of peer support services in SOAR programs and those best practices for implementing peer support services within your SOAR program. And you'll hear firsthand from peer support specialists who are incorporating their lived experience and expertise into their SOAR work to help others and themselves in their recovery journeys. So to reach those objectives, we will begin this afternoon with presentations from Sumitra Polkato, Project Associate here at the TA Center, along with Sean Wright and Sarah Smith, who are with the Capital Recovery Center in Olympia, Washington. And then we'll have a panel discussion featuring Meta Hogan, formerly from Capital Recovery Center, who's now with the State of Washington Healthcare Authority. And then you'll hear from William Wall, forensic peer specialist at Meridian Behavioral Healthcare in Florida, along with Tanisha Murdoch, certified recovery peer specialist with Broward House in Fort Lauderdale, Florida. And rounding things off will be Veronica Delgado, certified peer specialist who is with Presbyterian Health Plan in Las Cruces, New Mexico. And again, to read more about our presenters and panelists, you can see their presenter bios again on the SOAR website as well. So to do today's welcome, we have Asha Stanley, who is with SAMHSA. Asha?
Thank you, Pam. A warm welcome to all of you joining us today. On behalf of SAMHSA, I'd like to welcome you to this webinar titled Peer Support Specialist, a critical component for SOAR programs. Peer support specialists generate hope, open new doors, and increase people's sense of well-being. In addition, peers are very useful in helping people navigate the process, involved with accessing life-saving public health benefits such as SSI and SSDI. Today's webinar will give you many practical tips and tools to help you learn more about ways to incorporate peer services into your SOAR programs. I'd like to welcome and thank our presenters for your willingness to share your lived expertise with us and how you have incorporated your lived experience with your SOAR work. I will turn it back over to Pam Hine, who will be moderating today's webinar.
Thank you so much, Asha, for your warm welcome and supporting our webinar today, as you always do. Thank you. So joining us now is Sumitra Polkato, who will kick things off for us. Sumitra, you may begin your presentation.
Great. Thank you so much, Pam. Good afternoon, everybody, and thank you for joining. My name is Sumitra Polkato, and I'm a project associate here at the SAMHSA SOAR TA Center. I am extremely excited and proud to be kicking off this webinar today, as much of my professional work, both in this role and in previous roles, has always incorporated some degree of either developing or expanding subject matter expertise in the areas of peer work and/or recovery-oriented philosophy. Peer operated services have made significant strides over the years in demonstrating its value as an effective service for individuals with mental health conditions or behavioral health conditions, and in, of course, producing successful outcomes that promote recovery and whole health. With peer roles being incorporated in a variety of different settings, including settings in which public benefits, education, advocacy, and acquisition is occurring, it's really important to consider the positive impact that access to advanced training such as SOAR can have in helping consumers to access these benefits. And I can say personally, as an individual with lived experience with homelessness and in recovery from a mental health condition, I can personally attest that obtaining access to benefits can truly be life-saving for individuals within those circumstances. So over the next couple slides, I hope to just be able to demonstrate how SOAR work and peer work complement each other and how peer initiatives can be successfully implemented within SOAR programs and/or initiatives. There we go. All right. So let's kind of start off just with some basics in terms of what are peer services, who are peer specialists. So in its most basic sense, a peer specialist is an individual with lived recovery experience. So that could be from a mental health condition, it could be from a co-occurring substance use condition, it could be someone who has experienced a significant life disruption, such as homelessness or incarceration, but somebody who just has lived expertise in those areas and who then uses that experience to help others. So uses their lived experience in order to empower others, give them hope, and help others move forward in their own recovery. So peer services it is a unique role in and of itself, right? Peer services, a peer worker is not like a case manager light or junior, or it's not, it is its own unique role. So peer services can really help to complement that of therapists, of other case managers, really just other members of the treatment team in general, by sharing vital experiential information and real examples of the power of recovery to help another individual in their recovery. And some examples that I have there on the screen are modeling and promoting recovery best practices, teaching skills, supporting empowerment, and of course, aiding in system navigation, including that of the public benefits systems. So the value of peer services here now in 2022 has been very well documented over the years. The Mental Health America published, typically they do it yearly, but they published a really good study, really kind of talking about the evidence for peer support and really kind of demonstrating the value of peer services and the positive recovery-based outcomes that they've been able to successfully obtain over the years. Most notably in that peer services helps to better improve quality of life for individuals in recovery or individuals experiencing mental health conditions. It helps to increase and improve engagement with services, having that support. It helps to increase whole health and self-management. And it's been documented that it has helped to lower the overall cost of mental health services by reducing rehospitalization rates and days spent in inpatient services. Peer support services are utilized in a wide range of settings. It can include outpatient settings, bridger programs, crisis residences, crisis centers, inpatient hospitals, forensic settings, criminal justice programs, street outreach programs, and really any program that is utilizing SOAR work and peer work complement each other. And we hope to be able to provide you guys with some examples of that as we go forward along in these slides. In terms of who can provide peer support services, it can be provided by adults, youth, family members, and really any individual with lived experience. As I stated before, really anyone who's experienced some kind of significant disruption in life and is utilizing that lived experience, using that lived experience to share their story and help others, can be considered a peer. Now, when it comes to certified peers, and which we'll talk about in a little bit, each state has their own requirements in terms of certification to become an official certified peer specialist, but really anybody that falls in those categories can potentially be eligible to provide peer services. It should also be noted that those with lived experience, they can encompass a number of roles. So not only do they work in a number of settings, but they can encompass a number of roles within those settings. It can include support staff, case management staff, data collectors, evaluators, and community health workers. Trying to change the slide. There we go. All right, so let's talk a little bit about SOAR work, peer work, and some of the mutual benefits of that. And, I recall when I entered the field, when I first entered the field in 2014, and as I said before, much of my work in this field has always been community-based and or involved with peer work and or recovery-oriented philosophy. And I can recall back in 2014, entering the field, how so much focus was really spent on validating, really validating peer work and peer services as a respectable service, as an effective service of hey, this is a real, really, really just helping to prove that this is a really valuable evidence-based practice that really produces real results, that helps people to recover. And so much of the work and the focus was around getting that respect and buy-in from policymakers and from different health services and things like that. And I'm really, truly proud to see over the number of years the significant strides that have been made in, of course, validating those outcomes and validating peer work as this evidence recovery, as this evidence-based practice. And with those significant strides, though there is still a lot of work to be done in doing that, it's been great to see how the focus has often shifted to now really working on, okay, we validated peer services and the value of it. How do we continue to increase access to these services? And how do we continue to develop the peer workforce? And thinking and considering that, opportunities to participate in advanced trainings, such as the SOAR online course, can really provide peer workers the opportunity to acquire additional valuable skills and knowledge. Really kind of helping them to develop with those advanced trainings kind of has mutual benefits for a number of parties there, right? Benefits to the consumer, benefits to the peer worker, and benefits to the agency and the community as a whole. When we think about the benefits to the consumer, it's really been documented in so much of the research and the field evidence in terms of the value of individuals in recovery to be able to access peer services, some of which I mentioned in the other slide. But one of the best analogies that I've heard that I really like to think about it is, okay, if we were planning a trip somewhere, right? If we were planning a trip somewhere and we kind of wanted some advice, right? We are much more likely to go and ask somebody who lives there, right? Who lives there or who has been there, has that experience, knows firsthand because they are there in that moment accessing, whatever is there that we're looking to obtain, right? Versus somebody who maybe watched it on the Travel Channel, right? Now, does that person likely have some valuable knowledge? Sure. But again, we are much more likely to approach somebody who has been in the thick of it and knows. And I kind of like to think of peer support in that same analogy, right? Correct. So when we have an individual who is looking to who's experiencing homelessness and are looking to stabilize themselves, right? Thinking of the value, the importance of that guidance, of them being able to see someone who has been in that same situation and who has been able to successfully recover and or successfully obtain access to those life-saving benefits, but really just the value of having somebody with that experience, being able to walk with them, guide them through the process, offer that hope and support. That value is just immeasurable, right? So thinking of the benefit to the consumer, but also thinking of the benefit to the peer worker, right? The SOAR online course, and there are so many skills that are involved with being able to do SOAR work, and with peer workers being able to take that training and become certified and being able to gain those additional skills and knowledge helps to increase marketability for peer workers in competitive job markets, or is likely to, I should say. And it also too, and for many communities, right, and that are doing peer work, where oftentimes the need for SOAR can outweigh the capacity. Really being able to kind of expand these services to peer workers within your agencies, getting them trained, that thereby then increasing capacity of the agency and the expansion of available services offered by the agency into that community can also be immeasurable. Sorry. And so again, SOAR trained peer workers can really play a vital role in terms of increasing access to SOAR in general. Increasing agency capacity to serve more applicants, providing support to existing SOAR trained staff, and with them being able to use their lived experience and build those relationships, being able to improve quality of those applications, right? peers can also utilize their lived experience, if they have lived experience with applying for benefits, using that lived experience to help others navigate the benefits application process, which can often sometimes be complex and or a bit scary for those that are attempting to access that for the first time. So the SAMHSA SOAR TA Center has released a number of products in regards to being able to utilize, in terms of being able to utilize peer supports within SOAR work. The latest guide that we've released is integrating SOAR with peer certifications. And so with this guide, it really focuses on providing guidance on how can states, how can communities, how can agencies collaborate with their state peer specialist certification boards to integrate SOAR within that process, right? Because again, when we're talking about these things such as increasing capacity and helping to develop the peer workforce and really helping them to gain more skills and become more marketable, really kind of building it into the processes, into the systems that already exist, right? This document can be accessed within our SOAR TA Center library, and you can get that, which is available through our website. And we will talk a little bit more about that in a couple more slides as well. All right. Oops, sorry, let me go back to the last slide. So as we're going forward to the next couple of slides, we really kind of want to talk about, well, okay, we can definitely most likely all agree on the value of peer services, how helpful it is. But when it really comes to, okay, maybe I might be interested in doing this, what are just some strategies, key strategies or things that you might need to know if you're thinking about possibly integrating SOAR work within your peer initiatives or within your peer programs in your communities? And oftentimes, individuals think, sorry, I'm going back to a picture. If you look on the right, oftentimes individuals, right, when we're thinking of success, if we're looking at the picture on the top, right, we want success to look that way, right? We often envision it as this straight line, like, here's what I'm going to do, boom, 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 and it's all going to work and we're going to get there, right? But in reality, success often looks more like that bottom picture, right? As you can see, a little windy road there, right? There are often going to be twists, turns, might have to go back a couple steps, might have to go forward a couple steps, right? But the point is, when we are thinking about, when we're thinking about, hey, this is maybe something that I would like more information about or that I'd like to do, or I can see the value of it, really kind of thinking about there are a number of ways to consider implementing SOAR work within your peer initiatives, and that it may not necessarily just be like that straight line of success, right? That there may be other things that we may want to try, and that just like individuals, right? Thinking with our peer frame of mind, just like thinking of individuals as individuals, thinking of different agencies and communities as individuals as well, that are going to need different needs, going to need different types of support. And so just thinking about different strategies for that implementation, we've got a couple different things here for you to continue to consider and to think about it. And we really recommend the first thing that you really kind of ask yourselves, right? Like, given the wide range of diversity of peer work in terms of the type of peers and settings and things that are out there, really kind of knowing, hey, what is your ask, right? Really kind of sitting down, taking that time to reflect, to think about, what is it that my agency or my community or my state, whatever your role is within SOAR initiatives within your community, but really kind of thinking about, where do peers fit in at? What roles can peer workers hold within our SOAR initiatives? What problems are we looking to address? Is it lack of staff capacity to complete SOAR applications? Is it that SOAR is underutilized within your community or your state or your agency? Is it that you are looking to address underdevelopment of the peer workforce in your community? What is the gap that you're looking to address, and what roles can peers possibly hold in that, right? So really kind of thinking about, what is your ask? And so in terms of thinking about some of these SOAR initiatives and some of these asks, we've got some examples here on the slides, right? So perhaps within your community or your agency, right, you are thinking of, hey, we have peer workers here. We've got, certified peer workers here, and I would like to have peer specialists trained to complete SOAR assisted applications, right? So that means within that person's job role that they are completing full SOAR applications, right? And so, if you're kind of thinking that this might be something that would be helpful for your community or agency, some thoughts and strategies for implementation might include looking to see, identifying, right? So if you have peer positions already within your agency or wherever you are, really identifying a peer position that can reallocate job duties for SOAR, right? So are there existing peer positions within your agency that maybe are already doing similar work, right? Or doing work wherein SOAR work can kind of be rolled into that, right? So looking at, okay, there's somebody that this position fits, right, for a number of reasons. Or if there is not an existing position, but really kind of looking at, okay, can we create one? And this is extremely important. It's extremely important when it comes to really any job, but especially when creating peer positions, that you're very clear and defined on what the role is. And we'll talk a little bit about role drift as well. Another strategies as well, right, in terms of thinking if you want peer specialists or those with lived experience trained to be completing SOAR assisted applications. But really, another strategy could be considering looking at your job announcements. Is there language within those job announcements that encourages individuals with lived experience to apply? If not, maybe consider adding that or revising that, in order to obtain more individuals within your pool of applicants that have that lived experience, and whether they are certified peers or not. So maybe your ask is, we have peer workers, but maybe their role isn't necessarily 100% appropriate to necessarily be doing full applications, but you would still like for peer workers to support existing SOAR trained staff. And that could be in a number of ways. That could be maybe your peer staff are completing intakes, right? Or maybe they're serving more of a navigator role where they are helping the, the applicants to gather the documents and things that they need and then passing them along to the caseworker. Maybe it's that the peer worker is helping them to attend their appointments with Social Security office, right? So maybe it's that you would like for your peer workers to support your already existing SOAR trained staff with some of those SOAR, with some of the SOAR work duties, right? And so, again, if that's an ask that you think would be appropriate, for your community or your agency or wherever you are, there are a couple of different strategies and examples that we have listed there for implementation as well. Very similar to the first slide, we really recommend reviewing your existing peer job descriptions, right? Because if this is like a new duty or thing that you are expecting peer workers to engage in, you want to really be able to clearly define what exact support role they will play in the SSI and SSDI application process. So really kind of looking at the SOAR process as a whole and determining where peers fit in with that, right? Organizations really want to be mindful of avoiding role drift, right? Because peer support is so broad, and because there are a number of ways that peer workers can be helpful with an individual's recovery, right? Again, regardless of the setting, because there's just so much that a peer support worker can help with and provide support with and give hope to. Oftentimes role drift can come into play where peer support staff become responsible for a number of duties that may sometimes be outside of their scope of practice. We want to avoid that. We want to have clearly defined roles and expectations for peer workers. So really kind of reviewing those past job descriptions to clearly define what that may be. Some other strategies for implementation as well is that there's a number of support available for agencies or for local leads or state team leads or anyone who's really kind of interested in this peer work to be able to get in touch with, if there are local leads or state team leads or TA center liaisons, to really be able to hold orientation presentations or other type of TA support to assist them in this process. Another ask, and maybe you're looking at this webinar and you're looking at, well, integrating with the state peer certification process. That sounds interesting. Maybe one of my asks is that I would like for peers to take the SOAR online course as part of their core education requirements or their continuing education requirements, and thinking about some strategies for that. So we definitely recommend checking out the document that we released about integrating peers within the peer certification process. But the important thing to note here, of course, is that peer certification processes, the process for certification might look differently it looks differently in every state, right? And so you really want to kind of have a good understanding of what your state specific requirements for peer certification or continuing education are. A really good resource for that is using the Doors to Wellbeing peer state certification directory. It gives you really good information, including who the vendor is, what the requirements are, and what the requirements are for being able to maintain certification. So there are a number of ways in which, if you were interested in this, in terms of, there are a number of ways in which SOAR can be integrated as part of this process. And just to give you just a few examples. So for some states, the SOAR online course has been integrated within their core learning, right? So with every, a common denominator is that in every state, there is like a required core learning that aspiring certified peer specialists have to engage in order to become certified, right? And so in the state of Georgia, for example, they have incorporated parts of the SOAR online course within their core training, right? It's like an introduction to it. And then if peers, if the peers that are involved in that are interested in furthering their SOAR knowledge, they can do so, right? Other examples is that another common denominator with state peer certification processes is that there has to be some type of continuing education or learning in order to maintain certification. And so an example would be in the state of Louisiana, peers are required to complete 10 hours of continuing education a year to maintain their certification. And so with the SOAR online course being 20 hours, they have approved where if individuals, if peers take the SOAR online course, they can utilize those hours for their continuing education credits. So again, as you can see, like really just taking this training and implementing it in part of state processes, right, in part of the system in order to build SOAR within this processes to get people trained and increase that access to SOAR services and training. So just before I turn it over to some other key strategies for implementation, just some things to keep in mind, right? So another recommendation, regardless of which, whichever kind of options that you're looking at or you think are appropriate for where you are, really find a champion. Find who your champion is within your agency or within your community that really kind of cares about the cause and is going to address any issues that arise throughout the process. Like we said, remember that line with success. It is often complex and winding. It's often not a straight line. There are bound to be issues on a systemic level, on a community level that come up. So really finding your champion to help keep the development of peer services a priority and moving along. Another key strategy for implementation is ensure that your peer staff reflect the cultural, linguistic, and social diversity of individuals you'll be serving. So much of the important, I don't want to say ease, but like so much of what makes a peer relationship effective is that peers can relate to each other, right? Both from that lived experience, but also from a number of factors as well, right? So when you are forming this bond and you're sharing that relationship, hey, like, do we utilize the same language? Like, hey, do they understand this neighborhood? Like, hey, do they understand where the resources are around here, right? So really ensuring that your peer staff reflect that social diversity of the individuals you're serving. Definitely providing training for peer staff that covers the specific skills and tasks required in their roles. And then just lastly, just identify and value the unique contributions that peers can make to your program. Peer services are unique, peer services are effective, and the peer service provider role is its own role and career. And we want to respect that and continue to grow it. And hopefully, as you go through this webinar, be able to see how it could fit in different SOAR initiatives. And I'm going to turn it back over to Pam.
Great. Thanks, Samitra, for sharing your experience and also all the leading our efforts at the TA Center on expanding peer support services throughout all SOAR programs. So thanks so much. And you'll see Samitra again back during our general Q&A. But if you have any questions for Samitra, you can certainly feel free to start putting them in the Q&A box below. She'd be happy to answer them for you. So now we're moving along to peer support and SOAR in Washington with Sean and Sarah, who've been doing SOAR for a lot of years, integrating SOAR with their peer program. So again, now I'm going to hand it over to Sean, who will begin their presentation.
Good afternoon or good morning, everybody. Thank you so much for coming in, and thank you to my previous presenter who gave such an excellent presentation on peer work and gives me a good foundation to go forward here. I can't advance the slides. Sorry. Okay. My name is Sean Wright. I am the Community Programs Director, Community Outreach Director at Capital Recovery Center in Olympia, Washington. We are a established Capital Clubhouse model peer-run organization and have been in Olympia since 1988. Initially, we started just as a clubhouse drop-in center, but we have recently, or not recently, but we've expanded into several other programs. We have the initial peer support program, and we've also have community outreach programs, which include the PATH and Pathfinder programs, which are excellent peer-run programs funded by SAMHSA. Then we have our Justice Advocate Care Crew and foundational community support. We also offer a low barrier Suboxone clinic within our programs that we weave into all of our other services. With me today is Sarah Smith, and I will let her introduce herself.
Hi, I'm Sarah Smith, and I am a CPC certified peer counselor, as well as a SOAR representative here at the Community Outreach Office.
Okay. Could you advance the slides, please? I'm sorry, I don't have the ability. Okay, as the previous presenter explained, certified peer counselors, which CPC is the designation we use here in Washington, with our SOAR program, assist the participant through the entire process. The main thing that the CPC does, and the first and foremost foundation which we build all our work upon, is we first build trust and provide a level of empathy based on our lived experiences, and we are always non-judgmental advocates for the applicants. With the SOAR, as you know, SOAR is just one element. There is several other elements, and that is where we lean on our other outreach programs, PATH and Pathfinder, to help attain ID, attain birth certificates, get Social Security cards ready, and get all the pieces in place so when they are ready for starting the SOAR application, they have a head start and they're ready to go. Our peers here always create a welcoming and comfortable environment on site, but also have the flexibility to be able to meet people where they're at in other locations. We have people with mobility issues. We have people with issues with coming into urban areas, and people that like to stay more, and having that ability within our program to be able to do that right now via remote, but eventually in person, has proved to be integral in our work, and being part and out in the community has been very key in that work. Another part is the CPC then works with Disability Determination Services Specialist and SSA representatives on behalf of the applicant, and can be present during the conversation. And with this particular role, we find that people that do have lived experience with applying for Social Security have so much more to offer people that do. Not to say that it can't be trained, but it can be, it just gives a significant head start. So now I'm going to hand it over to Sarah, who is the actual working peer who does our SOAR program. And she is going to talk a little bit about her day-to-day process and how she engages with participants.
For a lot of the time, I am doing outreach, but I have folks that are referred to me, and I just set up a meeting with them. And usually my first meeting, I give them a 2-hour window just to be able to sit with them and talk to them and kind of make them feel comfortable, because I understand when you're dealing with Social Security and disability, it is very overwhelming and very stressful. I always make sure that I have all my packets set up and all the paperwork that I need, so that I can sit with the participant and go through as much as I can. And then any data entry I have, I do after they leave, so that way they're not having to sit and wait for me to get everything entered into the computer. And then I also just make sure on my end, as I'm doing things, I have a board that I have set up, that when I have new participants come in wanting to do SOAR, And then I have sections that I have set up when I'm in the process of doing the applications, and I break it down and know what all I have to do, that I have these forms left to fill out. I have the MSR report, and it helps me also keep tabs on what all needs to be done for that process. I can keep track of all the forms that are needed and everything. And I just work with the person and just do my best to make sure they feel as comfortable as possible and keep the stress level down. And I go through the process. And then once everything's done, I just make sure that they know that if there's any questions, if there's any issues, to not hesitate to give me a call. Let me know if we struggle or if there's any triggers while we're in the process. I let them know we have every availability for them to stop and come back. I do make sure that they know we have 60 days to get everything together and sent in. So I make sure that they know deadlines and everything through the process. And then at that point, once we get that done, I work with them on anything else they need to do, any other barriers they have. And we just work on trying to get them stable and get their SSI and hopefully work on getting them housed. That's pretty much what I have.
Thank you so much, Sarah. And I just want to expand on a couple points. Sarah mentioned the pacing. It is very, very important. I know there's a 60-day deadline, but we find that, not pushing and not pacing, because that, as you know, can provide significant blowback and is a lot of pressure for people. So really this, for this process, as we developed it here, it's really the key of it is meet them where they're at. So we are always available, but we don't push. We listen to the participant and listen to their concerns and have them be the pilot of the ship. They are in charge. They are the ones that live this life. And we really want to be there for them in a support capacity. And that looks like a lot of different things. And being able to have the compassion and the positive regard to be able to be patient through those things, because it's not always pretty, and triggers and various things at work. And let's face it, there's people that experience some abuse working with other agencies in this field, and not necessarily abuse, but bureaucracy. It can be traumatic, especially if you don't have all the tools to work with that. And that's where the peer is so key in this process, because the peer really provides that shown path to recovery and that experience path with all the roadblocks and all the hiccups that come along with that. And to have somebody that can actually go through the process in a very realistic manner and very well, prepare the participant really does improve the chances of success in this program. So thank you again, Sarah. I just wanted to expand on that point a little bit. Okay. Sorry, one slide too many. So challenges. So in developing this program, when we started, we were just doing voluntary SOAR certification for any peers that were interested. We had 3 peers that did agree to sign on for that. And that's kind of where we started with post-COVID restructuring with SOAR. With that, I found that my staffing was struggling because of the length of the SOAR and the amount of engagement that is required for a SOAR application. Having somebody, a peer outreach worker who sees 20 to 30 people a day, try to focus and connect with the SOAR and with this long engaging process proved to be problematic. So we shifted some things around, and we found some funding to bring Sarah on as a sole SOAR. She also does some case management with us as well, because she's just a rock star. But she is our sole SOAR specialist. And the kind of the structure that we went with is we are utilizing the Path and Pathfinder programs to get those foundational needs met. So get the ID obtained, the birth certificate obtained, any, another big one is cell phones. Find funding to get cell phones for your participants that go with this, and so they can stay connected. A big barrier that we have is a lot of people that are street dependent and experiencing houselessness have great difficulties maintaining a cell phone. They get stolen, they break, they get wet. It's just not a world built for that. So, you know, in your programs and as you develop these programs, put a strong consideration for that telecommunication element. It has proved to be very helpful for us. We're still implementing it too as funding comes available. But with this, we've had so much success with having the devoted SOAR person and being able to kind of build this structured system that we are actually going to be expanding this to our other programs. Right now, it is just within the outreach programs, which is where the greatest need is. But with our peer support clubhouse model, and again, with the Olympia Butte Clinic, which is our low barrier Suboxone clinic, it is extremely important to have that peace and connection because it really gives people a leg up in society and a chance to recover and to step forward and move on with their lives in a way that they dictate and that they are in charge of, which is at the core of everything we do here as peer counselors. So that is about everything I have for today. Here is my contact information. Please feel free to reach out to me, and I would love to answer any of your questions outside of this forum or within this forum as well. And again, thank you everybody for all the work that you do doing this field. It is such important work and we are changing the world. Thank you again.
Thank you, Sean. And thank you, Sarah, for sharing your approach, which sounds very motivational. And I'm sure there are many applicants who are waiting to see you right now, Sarah. So we appreciate you giving us your time, setting aside 2 hours. Giving your full attention to applicants is really a tip that I think many folks will go away from. So as our panelists, and you'll get to see Sarah and Sean will come back during our general Q&A, but right now we're going to bring up a group of folks who are part of our panel. So they're going to come up now with their cameras and get unmuted. And we're going to, have a round robin discussion, ask some really great questions. And again, thanks for some of those questions that have already come in. I think that this panel is going to be able to, answer some of your questions. And again, we really look forward to them coming in as well. So again, thank you so much. For joining us in this panel discussion. We do have a diverse group of folks from all over. We have several time zones represented. We have the East Coast, we have the West Coast, and I think we have Tanisha or Vanessa or Veronica who's in Mountain Time. So again, thanks again for coming up and being part of this panel discussion. Again, you can read more about our panelists. Their bios are available in the link that was provided in the SOAR website as well. So again, so my first question to you all, starting with William, is this. So what is your job role and how does SOAR fit into that now or in the past, especially MEDA? But we'll start with William on that question about your
Okay.
job.
Can you hear me all right?
Yes, we can.
Okay. Well, I'm a forensic peer specialist. And for those of you who get confused by forensics, it's criminal justice involved individuals with mitigating circumstances related to mental illness. So my clients all have a diagnosed mental illness that is a factor with their criminal charges. 2/3 of our clients are on mental health disability, and I'm one of the people that helps make sure that happens. As a forensic peer, I spend much of my time in jail or in court as a support person, or is just or interviewing or screening or whatever, following up on people in the jail. And I also teach peer groups in the jail and in the office. So when it comes to SOAR thing, an awful lot of our new clients, of course, virtually all of them are at risk of homelessness. So the first thing we do once we get them in there is we take a look and see if they might be eligible. And then I do as quickly as possible start the initial date and fill in the stuff. And like Sarah does, it's at least 2 hours, usually 2 1-hour sessions, one to get the application started and another one for all the follow-up stuff. And I try to not take anywhere near 60 days. 2 weeks is like the max, because the quicker they get it, the faster we can get their benefits.
Thanks, Willie. Tanisha, would you like to take that question?
Sure. So my job role is a mixture of many different roles in it. I work with the case managers through a grant called Wright. We work with those that are living with HIV. And the way that SOAR fits into it, most of our clients are experiencing mental health illness, HIV, newly diagnosed or returning back to care, and also substance abuse. And the way that that all fits into it, I'm all 3 of those. So I'm recovered, alcoholic addict. I have lived experience. I've never applied. Well, I applied for Social Security, but I didn't have a SOAR agent then. But with that said, I'm glad that I went through the road that, the path that it took me down, because now I'm able to help others and teach others new skills and to help them, to model for them as well, and to give them hope that they can also achieve greatness through just being persistent and determined to get through it.
Veronica?
Hi. So I'm a community healthcare worker and also peer support. So I carry that dual role. And what my job insists, especially in SOAR, is we get the referral. So we do the interview, the assessment, and right there it gives us gives me a blueprint of what social determination of health it needs. For instance, someone they're at risk of homeless. So what I do is I actually will talk to them, like where they're staying at, if they're staying at the homeless shelter, and kind of get like a second contact, because it's just, in the homeless population, we lose contact with them. So my job there is to make sure that I have a supportive network with people that I make sure that I can get with them. If the shelter, getting to know the case managers. But the good thing, especially what we have done with Presbyterian, is we are adapted to COVID. And I'm proud to say that I can help someone across the state, if it's telework over the phone, or we can arrange something over Zoom, and able to provide the, do the application and able to collect those signatures with teamwork. And I have a great department. We all help each other. With what I want to implement too with the community healthcare worker is I can see a big picture, what they're missing. If, for instance, if they don't have a history of, they're applying because they have PTSD or anxiety, well, I have to get them connected with a provider so they can have something to report to, or they're off their meds, or they don't have a regular doctor. So my role is basically not only doing the SOAR, but also doing the social determination of other things that can help them.
Thanks, Veronica. Maida?
Yeah, so like as you alluded to, my current role as the Homeless Outreach Stabilization and Transition Program Manager at the Washington State Healthcare Authority, I don't do any SOAR. I'm looking forward to collaborating with Wanda Johns, our state SOAR contact, to make sure that we're incorporating that into this brand new program, the host program. But historically, I first did the SOAR training as a mental health outreach worker back in probably 2010 when it was called the Stepping Stones to Recovery. And you went for 2 full days and you walked away with a 3-inch binder full of information. And that, I mean, it blew my mind. I mean, I remember like I'm working with people who have no resources. I don't know what I can do for them. And then I go to this training and I'm like, what if I could just wish that everyone would get $600 a month for the rest of their lives? What if I could just put in a little bit of effort and give someone that stability? And back then, of course, it meant healthcare as well. You know, people who didn't have access to healthcare would also then have medical coverage. And so it was life-changing for a lot of the folks that I worked with back at the beginning. And of course, the situation has changed somewhat, and now more folks have access to healthcare. And also the benefit that you get from SSI isn't really enough to rent a place anymore, most places. So it's a different picture now, but I never lost that sense of like, oh, it's a magic wand. We have this magic wand where we can, sit down with somebody and just show them the money, But in the process of doing it, I also got to, I thought I was good at creating rapport with folks and developing those relationships and, peopling with people. And in the course of doing the sort of the rigorous process of a SOAR application, I realized that there were a lot of things that I was stepping over, and I got to go deeper with folks. So I got to actually, sit down and like make space for people to actually just talk about what had happened, and there's a lot of trauma that comes out when you're not in problem solving mode, when you're not trying to get people money, when you're just making space for them to exist. There's a lot of things that they can say that, for most of them, I mean, my population historically has been sort of middle-aged guys who are chronically homeless with substance use disorder, and Social Security didn't really recognize substance use disorder for a long time. And so it was a matter of like establishing a period of sobriety or, somehow working around to explain what their mental health challenge is without maybe mentioning the substance use or stepping over it or whatever. But being able to have those conversations with people, I got the interrelatedness of it. I got that substance use disorder is actually a symptom for most people of the trauma that they have experienced and the compounding of that trauma through their homelessness. So it actually it changed the entire way that I do my work. And I'm hoping in my current role that I can bring that insight to the design of programs such that when we're doing outreach to the folks who are the most vulnerable, that we're actually acknowledging that that we're cleaning up after the things that have damaged our fellow humans, that we're not just, coming up and helping them with something that they've had to struggle with, but that we're actually cleaning up after our own culture and our own economy.
Well, thank you for that, Maida, and everyone else. So in moving along to our next question, and I think Sumitra, Sean, and Sarah really talked about that, but hearing from your own experience and your own viewpoint, how can peers really make a difference with SOAR-assisted applications? And why is it important for SOAR providers to consider integrating peers into SOAR work? What is your viewpoint on that in your own experience and just your viewpoints? And we'll again go back to William.
Okay, hi, it's William again. Well, the short answer is I work with justice-involved individuals with mental health issues, and I've been in jails, I've been in rehabs, I've been in mental institutions. So I identify with them on the lived experience similar to what they're going through. The second thing is that I spent 7 months in a mental health facility and I came out thanks to SOAR on disability, which gave me back pay of first, last, and security for a housing. And it gave me health and food stamps, healthcare and food stamps. So when I left that facility, I was able to take care of myself. Whereas if I hadn't had that, I would have been homeless and had no resources, because when I got out of there, I was definitely unemployable. And so I went through the same process I'm trying to help my clients go through. So that's a big thing, because I understand what it's like, the frustrations of how long it takes, what am I going to do in the meantime, that kind of thing. And I can say, well, I had to go through that too. And believe me, when you look back on it, it didn't take long. But for right now, it seems like it's taking forever. I don't know what else I could say. It's important for SOAR because, geez, if you got people working with the system who've actually had to go through it, not only do we know it better, but we also, we get more cooperation from the clients, really. They're not holding back any secrets, you know? A lot of times they don't want to tell their therapist or their case manager what's really going on, but they'll tell me anything.
Mhm.
So.
Right. Well, thanks, William. Yes, folks are trusting you with information they may never have shared with anybody, you know, very intimate information for their disability application. So, Tanisha, what are your thoughts on that question?
Well, for me, living with HIV, having mental health illness, and also being an ex-substance abuser, alcoholic, it was very challenging for me. I was once homeless as well. And, you know, even I've always been a very encouraging person for others, but not for myself. And so I learned to encourage myself through becoming a certified recovery peer specialist, because we do the RAP, Wellness Recovery Action Plan. And, you know, also, you know, using those tools that I put under my belt to help empower other clients that are facing similar situations such as homelessness, substance abuse, and living with HIV all at the same time. You know, it can be really empowering to actually be able to help navigate the systems. Okay, and I say systems because, you know, in the HIV world, where many of them aren't insured and they have to get their medications and they have to see a doctor every 3 months, then they deal with homelessness and no food, and they have to take food, they have to take their medication with food, and you know, transportation, getting that food. That's where I come in and I help bridge those gaps. And that's the importance of a peer to me, is bridging those gaps. Because, you know, without, you know, having a peer to support our clients, you know, the case managers, they do as well bridge the gaps, but it's just so many clients that having a peer there actually helps alleviate the load. So that's definitely a major component to our team.
Veronica?
Hi. So I think as a peer is building that trust in the relationship, especially in New Mexico, when we have a big rural areas, and some of them don't have that access to a peer, or they don't have access to some resources. So when I think breaking like Tanisha said, those gaps of like not only in relationships, but like building that trust. I can give you an example. I can, like William said, like I can have a peer share everything more than they can share with a probation officer, healthcare provider, behavioral health. And you letting them know that you've been there and you understand will make them really open up to you and able to get more information they share in order for them, for that SOAR application or the SOAR process to go easy for them. You know, and one of the things too is that I want to touch bases is that the live through experience. And I never applied for SOAR myself, but you know, I did the SOAR certification when I was in another agency, but in that agency, you know, we dealt with a lot of homeless population, and I was able to connect with a lot of people in one-on-one, and just getting that truthfulness and that trust, you know, with them, because they have been left down. They've been left down by many, you know, the system. I want to touch that able, like, hey, I'm here for you. I know what you've been through. But one of the things too, and this is part of the SOAR process, is I have dealt with people that are nonverbal. So with the nonverbal, I get like someone that I can, they have like either their representative and stuff like that. So I can identify with them as a kind of like a peer-to-peer to also taking care of someone and helping them get that process. So when someone is nonverbal, non-mobile, and they can't access, I'm there for them too. And then that person is there for them. Like I'm dealing with someone who doesn't speak, he doesn't talk, but I'm dealing with their POA, and that's a little bit frustrating for them, what's going on, but let them know that I'm there for support them and give them those resources. So as a peer, for me, is like, not only am I able to connect with that person for hands, but also as a caregiver. I don't know if that makes sense.
Yes, it does. Maida, how about you? What is your viewpoint on how peers can make a difference?
Well, I think there's, I want to go back to something that SAMHSA said in their presentation about folks who have actually been through the application process being able to be a part of it. And, you know, on the team that I had at Capital Recovery Center, we had at least two folks that I know of who had been through the disability application process and were navigating being employed while receiving disability, and having that like lived experience of the bureaucracy and the, you know, the need to track everything that closely, and the knowledge that, you know, recovery is possible when it comes to employment too. So we have people in the office who are actually, so there's an element of representation where somebody comes in and they're like, hey, I don't want to be disabled, but I think I might be. And I think I might need help with that, to be able to sit down with somebody who says, hey, me too. And it's not a death sentence, you know, you can still, you know, you can still have a vocation, even if you're dependent on this resource. That's a huge deal. And then also just for the nitty gritty, having someone who says, you know, oh, I went through this, I know the name of the form that you need, you know, because I'm SOAR trained and I could sit down and I could say, well, I don't know, let me look that up. If it's not part of the standard SOAR process, if they're going to get some you know, left field thing from Social Security, I might not know what that is, but there's going to be somebody then on the team who can say, oh, that happened to me once, and here's how you got to deal with it. And
Yeah.
not just clarify it, but make it so that it's like not a big deal. It happens to people. You know, it's not like you didn't do anything wrong. You didn't, you know, like there's so much with this, with the bureaucracy around disability applications that's re-stigmatizing for people, where it's like, oh, people go into it assuming I don't know how to do it right. I heard you have to apply 3 times. I heard you have to get denied. I heard you always have to hire a lawyer or whatever. So that people come into it with this, like, I'm already doing it wrong feeling. And if they have somebody else there, you know, whether it's the person working directly with them or whether it's somebody that they have access to just process with, or even just somebody in the office who can make eye contact and be like, I know what you're doing. It makes a huge difference in terms of people's sense of self-efficacy, because, you know, if a client can get to the point where they think, you know, somebody else did this, I think I got this. I've seen somebody who went through this and they came out the other end, and I think I can probably do it. That makes a huge difference in terms of their ability to actually get through the process and actually persevere with that bureaucracy. And I think that's the biggest thing probably, is that it gives them the sense of hope. Mm-hmm. You know, it's unfortunate that we have to work at cross purposes with ourselves. I mean, I love Social Security. Like most of the people that I've met who work there are amazing, but it's like, we're like,
yep. Yes, they are, Maida. They are amazing. They're our partners, and we can't do this without them. But again, it's a bureaucracy. So being able to help the navigation through this, because maybe you know, one of the peer specialists has been through the disability determination process and can debunk those myths. And as Sarah said, lower the stress level, because, okay, there's a contact we have at Social Security, and I've been there, and we can overcome this hurdle by submitting this form or getting this information. So thanks for pointing that out. Now, we only have about 10 minutes in this segment before we get to general Q&A, but I want you all to weigh in on this, because again, I know you've helped so many people with disability applications. So I want to hear like some of your success stories or anything like you're really proud of. And on the flip side, any challenges you would like to share. But again, please share some of those successes. And again, any challenges that you may have experienced that you want to highlight too. And we'll go back to William.
Okay, I'll make this real quick. A few years ago, I had a homeless woman who just got out of the Forensic State Hospital. I filled out the forms. I contacted as soon as Disability Determination Services sent the letter. I called the guy, I talked to him, I sent him a whole bunch of stuff. She was improved in 10 days and she got her check the very next month after she got out of the hospital. That's a success story. Since COVID though, I have another one which is almost identical. And it took 3.5 weeks for Social Security to get the packet. It took another 3 weeks for Disability Determination Services to get it. And it took 6 months for DDS in order to get all the supporting documents from the agencies besides the one I work for. So it took 9 months when it was an open and shut case. It was just 9 months of bureaucracy and poor mail service and home workers who were not checking the office and one thing or another. And the whole thing was almost identical situation. And yet it took 9 months to do, whereas the other one only took 10 days.
Great, thank you. Tanisha?
Yeah, so I had a participant that actually was homeless, struggling with mental health, struggling with body, just his hip replacement, old age, just getting to him. And it's just so crazy because we went through the appeal process. And we even had to have a hearing over the phone, which they, is a challenge on its own because, they can't see that, his injuries and where, he's disabled and everything is such a challenge. So they had to take our word for it. And also with the documents supporting from, hospitals and treatment centers and doctors' offices that he's been to. So creating that paper trail was just another challenge as well. But in the end, he was granted, back pay of $42,000. And, that right there is that's my best success story ever, and he was living in a hotel, for quite some time that was provided by funding from Broward Outreach Center, which is our homeless shelters. And now he's able to live on his own, pay his own bills, go to his doctor's appointments, buy a car. I was amazed. I was just elated. It's one of my best success stories. I have other clients too that they've also went through the challenges of the application process. Some of them got, approved within 180 days. Some of them, it took longer than others. But the key to it is to stay persistent and consistent throughout the whole application process, and don't give up no matter what. And definitely stay in contact with the DDS medical adjudicator examiner. They're my best friends because I'm always calling them. What else do you need? I'm here for you. I'm here for support. And, it's an honor and a privilege to actually be that person to help navigate this bureaucracy. Like you said, it's amazing. It's very rewarding. I mean, I wouldn't trade it for the world.
Veronica?
So I got a couple success stories, but this one is really imprinted in me because it was my first SOAR application. This is a few years back. Gentleman was homeless, living in the streets, rehab back and forth with alcohol, and I assisted him with the SOAR application. And then when I finished the SOAR application, I guided him to apply for GA. And finally, after a few months, he not only he got approved, but I was able to follow the which is like the recovery part, housing for him, and it changed his life. And I got to see that within the course of 2 years of that happening. And for me, it's imprinted because it was my first application, and I saw the transformation of this person. And now I still waiting on this because I barely finished the application, but I'm very proud of this one because I'm able to help this person member because I'm advocating for them. I'm their voice because they don't have a voice. And when things seem like there's no support, I'm there to support them through the application process. And also if I'm stuck, I'm proud of this to say that I have a great team to support me. You know, we do monthly STAT meetings, or I reach out to someone, and I'm proud of it because I think that's the key point of like getting these success. And I hope, I'm crossing my fingers this application goes through, which I'm positive it will, but I'm proud of it on this one because this person was, like I said, nonverbal, doesn't move, but I was able to do it with their power of attorney person speaking for them and getting documentations, medical records. So I'm really proud of that one because it was my first time, and it was a very challenging. Like a third, kind of like getting that third person narration, you know?
Yes.
So.
Thank you for sharing that. How about you, Mady? You may have to think back a little bit. It may have been a while.
I do. I have actually my proudest SOAR moment. So I was working with a fellow who had kind of a spotty work history. So he was maybe eligible for SSTI. And at the beginning of the process, I thought that might be possible, but just profound history of trauma. Like he had been in and out of foster homes his entire childhood and had just, been through the worst of it. And we were trying to sort of suss out, well, who could speak to that far back? Could somebody testify to what you were experiencing when you were younger? And he said, well, I had this teacher once. I had my second grade teacher. She really took an interest in me and took really good care of me throughout that entire year, but it would be impossible to find her. And I was really fierce about SOAR at the time. So I just went on Facebook and looked her up, and I found her and I messaged her and I said, hey, I have a question about one of your former students. I wonder if you'd be willing to talk about it. And, I sent her my email, and when she emailed back, she said, I think I might know who you're talking about. And it was the same guy. And she said, I just always thought he was so special, but just he had these circumstances that were impossible. And so she ended up writing a supporting letter for his SOAR claim, and he got approved. And it was really, the thing is, it was great that that helped him get approved, but it was also, he then ended up reconnecting with her. And I'm sure for her as an educator, that was also a huge moment to be able to see somebody, who she had maybe had concerns about. I can imagine as a second or third grade teacher thinking that guy's not going to make it past 20, and here he is, he's like almost 50 and he's doing fine, he's homeless, but yeah. So she was really excited to participate in that, and it really worked out well for him.
Well, that's great, Maida, sharing that, getting collateral information, going way back and going that extra mile really made the difference. Your advocacy made the difference with that. So that's great. Now, we only have a few minutes left, maybe less than 5 minutes. But I think I want those who may have been in a supervisory role kind of to weigh in on this question. So again, what are your strategies for providing training and supervision for peer staff? And how has your agency incorporated peers in planning and even leadership? Or maybe if you haven't been in a leadership or supervisory role, what kind of training and supervision have you found helpful? And again, maybe just pick your highlights for that. And I think maybe we'll just go back to maybe Maida, if you want to talk about that, because I know you were in a supervisory role, if you just wanted to share quick strategies on supervision.
That was my jam. Yeah, no, I mean, I love where I'm at now, but I'm like, oh, I wish I could go back and supervise peers. I think the big thing is, like I've worked in a lot of different places. I worked in the food service industry for a long time, and I've never had a job where I didn't work alongside people who had lived experience with mental health symptoms, substance use disorder. These are challenges that a lot of people face. And if you work for a regular employer who doesn't have peer services incorporated in their book of business, everyone just has to pretend like they're okay all the time. And if you work for, say, a peer-run organization like Capital Recovery Center, then everyone is encouraged to just like bring that to the forefront. Here's what I'm struggling with. Here's what I'm working on. And you get to get help working on it. And so I think the thing is, like, as a supervisor, for me, it was really important to recognize that it's not just giving people space for self-care and, helping people figure out boundaries. It's really about professional and personal development for those individuals. So it's really about creating space for people to become. Because I think, particularly in services that are explicitly based on lived experience, that's the possibility, is that you can use your career to become. So, and when we're talking about SOAR, it's like such a huge professional development opportunity for people who are coming into, I think of people who are like, okay, I have some lived experience. That's a ding on my resume for any other job except peer services. So I guess I'll become a certified peer and I'll do this. But then you get this, oh, okay, well, you go through the SOAR training and you do a few of those cases, and then you think, well, I could maybe be a paralegal, or I could be a case manager, or I've got this documentation thing down. I know how to build a case. I know how to, and it opens up all that possibility for folks. And so as a supervisor, that was the really exciting thing for me, was being able to say, like, okay, you come in because you have lived experience, but then you leave because you have lived experience plus all of this professional development that you've been able to add on to that.
That's great. Yeah.
Yeah.
That's huge. Anyone else want to kind of chime in before we leave the segment?
I want to chime in. I'm not in any supervised role, but we do have people like in our SOAR lead. We've got like maybe two or three that we can actually go there for guidance, and also like peer, like the SOAR coach who has done it before a while, so we can go there and ask, hey, I'm stuck there. So I think like someone who's been there for a while doing this for us, like for me, I can always go, and we have refresher trainings in our agency. So we have refresher trainings, and there's always trainings open for instance, community healthcare workers that want to pursue SOAR. And I think SOAR has opened, so when I became a peer support, then I became a SOAR advocate, has also opened my development to, I can give it for to community healthcare worker. Now, I'm not only my community healthcare worker, but this has developed a blueprint. I'm going back to school to get my bachelor's in social work. So I think that has grown into me there. So I'm currently in my junior year, and even though I'm later, but I'm reaching it. That has helped me develop my calling.
That's a great point to end on too, about the stepping stone in your own careers. Being SOAR trained can really help open up so many doors. So thank you so much, panel, for this, these great responses and tips, and sharing your experiences. We're gonna now move into, before our general Q&A, we do have a poll. So we're gonna launch a poll where folks can really put their name and email. Should you really be interested in, here's the question here. If you are interested in learning more about our peer learning community, please provide your name, state, and email. And again, it's anonymous, so you can put it here, and we're gonna keep it open for about a minute or so. But if you, for some reason, can't enter it here, using this poll, there is an opportunity for you when you complete the evaluation. There's a kind of a short answer area where you can put questions or comments in as well in that evaluation. So kind of give you just about a minute or so, to write that. Again, if you're interested in learning more about our peer learning community, please put put your information here. We'd love to know. We'd love to learn more about your interest in pursuing this at your agency. So we thank you for that. And again, I just want to thank all the panelists. And again, please stay up, panelists, with your cameras. And then I'm going to ask Sean, Sumitra, and Sarah to kind of come back too, so that they can participate in the Q&A. And also, if there were any questions that you wanted to kind of add your viewpoint, we would love to have you do that too. And again, if you have any questions, you can put them in the Q&A box. And I've been looking at some of the questions. And I think, thank you for sharing what your agencies are already doing with SOAR and peers in your states. We really do appreciate that too. So I think we'll close the poll. We'll get that closed down and kind of move into the Q&A. And I want to make sure we get all the panelists back up here too. There we go. I see everyone. I think we closed that.
And a lot of people, sorry to interrupt, a lot
Uh-huh.
of people are, I see the number going up. I think a lot of people are trying to get their information in there still. So we can just go ahead and start addressing the questions while the poll remains open.
Oh, okay, that's good. I was afraid that I just took it down.
No.
Okay. Again, thank you so much for all of these great questions and comments that came in as well. And I think hopefully some of these were answered when the panelists were speaking, especially when they were sharing some of their tips. But I really wanted to get this in here, for everyone, for all of our panelists, just to share any words of wisdom or recommendation for peers out there who are considering SOAR training and doing this kind of work, taking the course and doing the training and figuring out what their role might be. I just wanted to throw that out there to whoever wants to start. Any words of wisdom? Because again, I think we're probably down to our last 8 or 9 minutes. So.
Well, I can go first. First thing is I took the online class last year, maybe the year before. I took the initial class years before, and I thought it'd been a long time since I'd done it. I took it again, and I found that it was quite difficult. By the time I got done, I had to do stuff over and over again. By the time I got done, I really understood the process well, because they sent at least one thing back every time I did it, and I had to redo it. The other thing is that mental health disability is hard to document. All the forms are almost always geared towards physical disability. They want you to go to the doctor, have the doctor, you bend over, see if your spine is straight. They tell you if it's disabled or not disabled. And mental illness is an ongoing situation. So documenting that requires a lot of other stuff. I found that I send as little as possible to Social Security, and like Tanisha was talking about, try to build a personal relationship with the DDS caseworker and find out what it is that they need in order to approve this. And I have found that there's a lot of documents that when they ask for medical records, they don't get them. They don't get stuff that will help with mental health. They get their diagnosis, they get their biopsychosocial eval. They don't get a lot of the other stuff. And a lot of that other stuff is what's going to convince DDS that they're not capable of working. And I also, for myself and for others involved with getting disability, is I really stress the fact that disability is about not being able to work, not being able to get a job. So your criminal history and your substance use patterns are not disability. Disability is when your mental illness makes you unable to get a job, keep a job, or keep a job. And so documenting that stuff like work history, that sort of stuff that is not included, patterns, and the medical summary, guess what? I got letters after my name. You don't need an MD after that. The first line of my medical summary is, this is a SOAR application. And then I go into and summarize the stuff. And then I signed a letter with all the letters after my name. And for those of you who see the PhD there, that PhD is in English not in psychology. I was a college professor whose life got exploded, and I spent times homeless and in institutions and stuff. And finally, this Ticket to Work program for disability sent me to where I work now, and I've been here for 12 years.
Yeah. And William, we know that you have a very high approval rate. It just came through
Yes,
our way. So we know
I
you
am
do
not
quite well.
I find that that if I do my homework, it's appealed on the first time. I have done very, very few appeals. If I do it right, then they get approved the first time. So anybody who tells you got to be turned down 3 times, I tell them that's hogwash. None of mine get turned down 3 times.
That's our motto, get it right the first time.
Get it right the first time, yep.
But I think it was Tanisha that said, she was persistent up until further in the appeal. So yeah, we really try to get it right the first time. Here's a question that came in. As a SOAR peer support specialist, do you find it hard to encourage families to complete the paperwork to get everything started? From my experience, it's hard to get the paperwork completed when families have tried for years to obtain that support for SSI. So really maybe encouraging families to keep going with the process and maybe utilize you as a peer support specialist to get them engaged again in the disability. Who wants to kind of take that and working with families who may be reluctant to do this again?
I can jump in, Pam.
Mhm.
I think that that's a really great question. I think especially because those of us that are peers on the call typically know that, like, if an individual typically wants to include their family of choice within their treatment, then we try to accommodate that as much as possible. And I think in a process that can be as complex with as applying for Social Security benefits, that as we're working with the individuals, if they would like their family of choice to be involved, then maybe they can be involved. They can be present during when we're helping them fill out the forms or when we're writing the MSR. And in some ways, as part of that collaborative process, helping them understand the process as well, and hopefully helping them see the value and the benefit of being involved through the course of us doing that.
That's great. Does anyone else want to chime in? We have about 2 minutes.
I say the more support, the merrier.
Mhm.
It's great to see that a participant has that support from their family. Most of them that I deal with, they don't have support from their family, and on top of that, they're dealing with a diagnosis that they kind of keep on the low key, like hush hush. And so it's very difficult to actually see that, but I've had clients where their sister or their mother has been applying for them. And, I just do an SSA 1696 appointed representative, and, I join their team. And I don't try to go in and take control. I just see where can I be helpful in the process, and that's important for me to know that, because not only, am I playing a role as a peer, but I'm also help navigating them through the system as well, because I've done so many applications as well.
Yes, that's so true. So in about 30 seconds or less, a word of wisdom. People were throwing around some great words out there to people to take away with. Let's start with Sean. You can think of one word of wisdom.
Always do your work with unconditional positive regard. You do not know what that person
Right.
across the table from you has experienced.
Absolutely.
William?
Oh, I was just agreeing with him. I see this last question. Does SSI and SSDI applications start with SSA? No. Keep their hands off it as much as possible.
Yeah. And thanks so much. Is anyone else? We have time. Just you want to parting words?
I will say
Deeply.
unconditional positive regard in action looks like rigor around the application. Like, your attention to detail is the way that you express your love for your clients
Mhm.
when it comes to putting together the application.
Well
And
said. Well said.
And
If I could-
one of the
Go ahead,
things that-
Veronica.
Oh, I wanted to say, like, it doesn't hurt getting these refresher courses too, because, every year things change. And also, getting connected with your SOAR liaisons at your local Social Security office. But also, one word of wisdom I'm going to just take away. If you're a peer and you're not, and if you are interested in SOAR, just get connected with someone that you know is a SOAR or your SOAR lead, your state lead, to see how you can get in there.
If I could piggyback off of Veronica, I was just going to say utilize your supports. And that's both when you're in the midst of doing SOAR work, utilize your colleagues, utilize your supervisors. And that's also for us at the SOAR TA Center.
That's great. Thanks,
And
Anitra.
I'd like to say, just don't give up. Keep going no matter what. I mean, I've had clients cancel their appointments, couldn't make it, and we're just right there. We're right there. But remember also, you can't want something more than the participant, you know, so you have to kind of find that middle ground and understand that sometimes it's a process, and it is a process, and you have to go through it, and every client is going to be different. There's no uniform client. There's a uniform process for the SOAR process, yes, but every client is going to be different, and just be patient and love on yourself a lot. Self-care comes first.
Self-care. That's always a great to end on self-care. Here's some resources. Take a look at them. We really, want this to be the beginning of a discussion. So we want you to, again, learn about what's going on in your own backyard, connect with your SOAR TA Center liaison. We really want to help you figure this out. We're available to you. But again, do the evaluation at the end. If we didn't get to your question, don't worry. We're going to package them up, get them all answered, get them forwarded to the relevant presenter, and be in touch with you then. But again, the evaluation does have a spot for you to put a question or comment in there as well. Again, it was a pleasure talking with everyone today, all the presenters that put in their time, their valuable time to this important webinar. And so really I just wanted to say to even the participants who joined us today, again, thank you so much for giving your time, and best of the new year to all of you. Stay well and be in touch. Bye-bye.
Thanks, Pam.
Thank you,
Thanks, Pam.
everyone.
Bye, everybody.
All right, take care, everyone.
Bye.
Thank you.
Thank you.